Our news is brought to you by Alive.
Believe in best.
Coming up tonight in Our News, a holiday weekend jet ski ride ends in tragedy. You've got the story. COVID concerns growing as new variants emerge. Plus, Crystal Cruises eager to get into Bimini. Welcome to Our News, and thank you for joining us. I'm Kyle Joaquin. Civilians, family, and friends of 28-year-old Drew Rigby joined the Royal Bahamas Defense Force in searching just about all day today. Rigby was one of two people on a jet ski when it collided with a 26-foot boat near Rose Island after 7 last evening. The driver of the jet ski sustained injuries to both legs, according to police, while Rigby was thrown into the water. RBDF search efforts were called off just after sunset last night due to low visibility. Today, people with boats joined search efforts, battling rough waves and rain. We spoke with his god brother earlier who held back tears, making a plea for assistance to join the search.
Right now, we are making an appeal with anybody with a boat or anything that can assist us in this rescue effort. We are grateful for any assistance. Persons with boats who are able to come and help us go out to the Rose Island area to make sure that we find him.
Infectious diseases expert Dr. Nakia Forbes expressing concern tonight as the Bahamas remains in a third wave of COVID-19 infections. With Princess Margaret Hospital at capacity with COVID-19 patients, Forbes said Bahamians must continue to be cautious.
And at the close of our last epidemiological week, there was a slight uptick in the number of cases, and the prevalence or the percentage positives of the tests that were sent into the lab has also increased as well. And so we are seeing an uptick in the number of cases. We know hospitalizations have also gone up, and now they're in the 50s, about 57 hospitalizations at the end of that week. And so we are seeing an uptick, and it is cause for concern.
Forbes says as the country continues to battle the third wave, there are a number of factors that are concerning.
One of them is emerging resistant strains like the Delta strain, which we could talk a little bit more about later on. And then the other thing is that people are putting their guard down as it relates to the public health measures and not following them as tightly as before. There is increased movement of people with COVID fatigue, and then globally there has been an inequitable rollout of COVID-19 vaccines. And so those factors together are very, very concerning for public health doctors and infectious disease doctors, because we know that those factors will lead to COVID increasing or rebounding, and we stand to lose the gains that we have accomplished in the fight against COVID. So we do have to be concerned.
With variants of the virus, in particular the Delta variant, making its way through countries around the world, Forbes says it's important that Bahamians do not let their guard down.
There are emerging variants. They are considerably more contagious. They're 64% more contagious than the Alpha strain that had been described, B117, that was first described in the United Kingdom, which was more contagious than the original COVID strain. So this Delta strain is very infectious. There's more of it in the airways of people who have this Delta strain. And so we really do have to follow those simple guidelines, like wearing a mask, avoiding crowds, avoiding gatherings as best as possible.
Government will begin receiving overflight fees for the month of May for the first time in the country's history. According to Tourism and Aviation Minister Dionisio de Aguilar, this will amount to $2.7 million. He said that number is expected to grow in the near future. Here's Bertha McDermott.
Government will be collecting more than $2 million for airline fees in Bahamian airspace for the month of May, according to Aviation Minister Dionisio de Aguilar.
For the month of May, our first month, we will be billing approximately $2.7 million to aircraft that flew through our airspace in overflight fees. So if you extrapolate that, you're falling well within the $25 to $30 million of revenue that we now expect to receive from this natural resource.
In May, the Bahamas Air Navigation Services Authority and the United States Federal Aviation Administration signed the agreement, which de Aguilar said is expected to bring in around $300 million in fees over a 10-year period. This allows the Bahamas to manage its own airspace and charge fees. As the world emerges from the global pandemic which crippled the airline industry, the aviation minister said the figure is expected to grow over time.
And as you can imagine right now, air travel is down somewhat. bouncing back, but down somewhat. So we expect that number to increase over time. So very proud of this moment, very happy and delighted that we've been able to yield some revenue from this natural resource for the very first time in our history.
He reiterated that revenue from this will not go into the consolidated fund.
The revenue that we will realize from our overflight fees can only be used in two government agencies. The first is the Air Navigation Services Authority, which are basically the air traffic controllers, those that provide air navigation services within our airspace. And secondly, the Civil Aviation Authority Bahamas, which is the regulator of our aviation sector. So those resources can only be used to fund those agencies and cannot be used to go into the consolidated fund to fund other government expenses.
While many have criticized the move, De Aguilar said it's actually saving the Bahamian people millions.
But what the government has been able to do, and where the Bahamian people will realize the savings, is that no longer does the government have to fund those two agencies, the Civil Aviation Authority and the Air Navigation Services Authority. No longer will it have to fund those agencies, and that amounted to about $18 million in prior periods. And so that money can now stay within the consolidated fund to take care of other pressing needs of the government, such as social services, education, healthcare, and the like.
Reporting for Our News, I'm Berthany McDermott.
Well, amid speculation of an early election, a member of the Minnis cabinet is defending their last 4 years in office. Jasmine Brown reports.
Minister of Youth, Sports and Culture Iram Lewis lauded the Minnis administration's handling of the country's affairs during its term in office so far. He says while all the decisions have not been popular, he believes they were the right thing to do.
In some instances, you make decisions, like I said earlier, that is not popular, but you have to lead, and particularly when you're convinced, in some instances, that it is the best thing to do.
Some of those unpopular decisions included raising value-added tax by 60% during the second year in office. More recently, there has been criticism over the handling of the COVID-19 pandemic and the ongoing state of emergency that has been in place since March 2020. The newest state of emergency was declared by the Governor General in May. This gives the competent authority the ability to have up to another 6 months of emergency powers and the ability to implement mitigation measures like curfews and lockdowns. Lewis defended the move.
We were guided by science, and even as being involved in the political side of it, we know we had to make some decisions that didn't work in our favor from a political standpoint. But we look at the welfare of the nation as being bigger than politics, and we make decisions based on that.
Lewis says moving forward, he hopes people realize the Minnis administration is only seeking to do what's best for the country. He says he hopes Bahamians can find more common ground and not be divided by politics.
I'm hoping that as a nation we continue to mature. And going into our 50th anniversary, one of the goals is that we'll bring the nation together in the Bahamas Games. And it's not about politics, because if it was about politics, then we would have had the Bahamas Games next year, which would have been perhaps inside of the window of elections. But understanding that we will be 50 years in 2023, we are planning a grand celebration where we can bring the whole country together through sports.
Reporting for Our News, I'm Jasmine Brown.
Health Minister Ronwood Weld says the government doesn't intend to relax the mandatory mask policy anytime soon. He also addressed concerns that some American visitors are unhappy about wearing masks on vacation after the United States dropped its mask policy for the fully vaccinated.
We are still under the health protocols, and the law of the land is what has been issued by the cabinet through the competent authority, which is that Bahamians are still supposed to wear masks. I'm not wearing one, I'm fully vaccinated, but at the end of the day, that has been the health protocol that has been in the confines of the environment folks are supposed to. But obviously, they're coming from the United States where there's no longer a mask mandate.
U.S. media reported that a Bahamas-bound flight was canceled on Monday after a group of high school passengers refused to wear masks. American Airlines Flight 893 had been scheduled to depart Charlotte Douglas International Airport at 9:30 a.m. for Lynden Pinling International Airport. Wells says at the end of the day, policies are in place to protect the health and safety of Bahamians.
It's just up to us in country to ensure, but the government is looking at all of those. As you can see, we have been relaxing the health protocols in regards to those who are vaccinated. And so I think the Bahamian people can look forward to based on the health team recommendation, us moving into a much more open environment.
Crystal Cruise is still eager to get into Bimini. The island was the first scheduled stop on the historic 7-day cruise through the Bahamas. However, after Bimini was placed under curfew due to an increase in COVID-19 cases, things changed and Exuma became the first stop. Crystal Cruise's corporate manager, Kevin Jones, says they can't wait to add Bimini to the itinerary.
As soon as Bimini is ready and that it's safe for everybody involved, Biminites, our resort staff there, and our passengers, we are ready, willing, and able to show up at Bimini, and we can't wait for people to see that as well.
The first week of cruising throughout the Bahamas wrapped up on Saturday. The cruise took 570 passengers to Exuma, San Salvador, Long Island, and Grand Bahama before returning to Nassau.
It's amazing. This is what we wanted our guests to see and everybody to realize that we were trying from the very beginning to pair up the most traveled guests with the most amazing experiences in the world. No better place to start than here.
Still to come, vaccine hesitancy remains a concern, and later, the Lead Institute launches on Grand Bahama. Stay tuned.
Every new season of On the Record, we push the limits. Venture into unknown territory. We take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV Cable Channel 212 and streaming live on Facebook on the R News Bahamas page.
Vaccine hesitancy is still a major concern here in the Bahamas, according to infectious diseases expert Dr. Nikia Forbes. Over 95,000 doses of the AstraZeneca vaccine have been administered in the Bahamas so far. However, Forbes says there are still many in doubt.
I can tell you more than 98% of the people who were hospitalized have not had any vaccination at all. There are a few persons who've had one dose, but the news you can use is this. There are no persons who've been fully vaccinated against COVID-19 in country, that's 2 doses 14 days apart, that have ended up hospitalized with us at Princess Margaret or dying. So vaccines do work.
Forbes said even after Bahamians get vaccinated, they should still follow public health protocols. She also responded to questions about how effective vaccines are.
Vaccinations are also very helpful. There is effectiveness against that strain. It is somewhat less effective than the original COVID strains, but the AstraZeneca vaccine is still 60% effective from getting that Delta strain. And it's also very, very helpful. If you've gotten 1 dose of the AstraZeneca vaccine, that's effective in reducing hospitalizations from the Delta strain by 71%. And if you've had 2 doses of the AstraZeneca vaccine, it's effective in reducing hospitalizations from the Delta strain by upward of 90%, around 92%. And so these vaccines, even though they're not as effective as the original COVID strain, it's still very, very effective to prevent hospitalizations and death.
Well, Chinese ambassador to the Bahamas, Dai King Lee, says more Bahamians should get vaccinated and suggested that the level of vaccine hesitancy in the Bahamas is worrying.
I'm sure the Bahamas government has a well-considered plan to ensure vaccination in this country. Yeah. But if I were you, I would be more worried about vaccine hesitancy in this country. I think we need to encourage people in the Bahamas to try to get vaccinated. Yeah, that's the most important thing. Because even now we don't have effective medicines for this COVID-19 virus. So the vaccines are our best hope and the best protection against the virus. So hopefully people would, eligible people will consider getting vaccinated.
A recent United Nations situation report indicated the Bahamas is among the countries with the lowest percentage of vaccinated people against COVID-19 in Latin America and the Caribbean. As of July 5th, the country ranked 24th out of 30 countries listed with only 15.2% of people both fully and partially vaccinated. King Lee said the Chinese government is committed to assisting the Bahamas in the fight against COVID-19.
We have every intention to provide more help to the Bahamas. We have so far provided 5 batches of medical supplies to this country, and we are in the process of purchasing and shipping another batch of medical supplies. But due to some transport problems, this is a bit not as fast as we hoped or expected. But in any case, we will try our best to make sure that these shipment arrives safely and as early as possible in our country.
Still to come, the Lead Institute expands its reach to Grand Bahama, and later, a non-profit seeking to provide housing for mothers in need. Stay tuned.
Every new season of On the Record, we push the limits. Venture into unknown territory. We take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV Cable Channel 212 and streaming live on Facebook on the R News Bahamas page.
This is Our News. Welcome back. The LEAD Institute establishing its presence on Grand Bahama. After years of helping to change the lives of young men on New Providence, the organization opened an office on Grand Bahama. LEAD Institute President and CEO Troy Clark says their aim is to provide more opportunities for those who have had many doors closed on them.
Today is more than simply the launch of another social program. It is more than merely another ceremony to open another building. Today is an opportunity to invest in change by providing a raft of support for those who may not be able to swim on their own.
The LEAD Institute is credited with changing the lives of many of the nation's at-risk individuals and those recently released from prison who've been looking for a fresh start. Classes, workshops, and job opportunities have been offered through the program. Clark said the goal is to transform lives all over the country.
This mission is based on recognizing that our success as a country is seen in how we treat the most vulnerable and disenfranchised. As a nation, we cannot afford to ignore the potential in the persons who slip through the cracks, fall short of social expectations, or are found guilty of being on the wrong side of the law. LEAD's goal is to ensure that every Bahamian who requires pre- and post-correctional facility assistance or is deemed at risk is supported and equipped to take on the world and make a meaningful contribution wherever they live.
Grand Bahama Minister Kwesi Thompson said he knows the LEAD Institute will have a great impact on the island.
And we have, as was said, to work together. The government has to play its part to provide social support, to provide economic empowerment. The family has to provide its support when it comes to spiritual and moral. And then we have the community, where the church and community groups and civic groups like yourselves have to also come together.
Still to come, a nonprofit fights to get young mothers off the streets. Stay with us.
Every new season of On the Record, we push the limits. Venture into unknown territory. We take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV Cable Channel 212 and streaming live on Facebook on the R News Bahamas page.
Welcome back to Our News. With homelessness becoming more of a problem due to the pandemic, one nonprofit is hoping to provide housing assistance to young mothers. Jillian Gray has the story.
It's a story heard all too often, a mother and child living on the street and struggling to survive. One nonprofit organization hopes to be the solution to the long-standing problem of homelessness among young mothers.
We've seen a lot of their stories on the news. However, I found that there was no avenues or no support mechanisms in place to really assist them on their journey. So this transitional home here is being launched to help them, give them enough adequate time to be able to get their bearings and to be able from actually moving them out of the red into the purple.
For the last 4 years, TLS Services has focused on providing baby items to young mothers. The group is now taking that assistance even further through the launch of its transitional housing program. Founder Felicia Carey took us on a walkthrough of what phase 1 of this project entails.
They have a small front room, they have a bathroom, changing up the fans, changing up the zincs in the cupboard and so forth, and painting. Okay. So this is a room would just need minor repairs, but the major repairs would be for the mess hall and the meeting space.
Carrie says they're looking to complete the minor and major repairs to the facility within 18 months. When it's complete, the facility will be able to house 7 women and their children. TLS Services gave away over 4,000 essential baby items during the pandemic, but even that wasn't enough. As Carrie says, the pandemic has made life even harder for many.
It's not that they don't have the need or they don't have the tenacity for life change, but because they're so busy battling the elements, they're so busy knocking about, so to speak, to the community, they don't have time to engage in educational programs or initiatives that would help them. They're too busy in survival mode, and then we know how that normally ends.
And these are some of the stories that you would have heard.
Yes. And what I'm fearful of is we don't want a situation where a mother takes her own life and her children because she doesn't have any place to go. Everybody closes the door, or if they open the door, there's abuse behind that door. So that's where this transitional home is a need, and that women and mothers can rest assured knowing that they're in a safe place while they're getting the assistance that they need.
She says many women are in the fight of their lives, something she relates to from her own experience. Her hope is that the transitional home can give them and their children stable footing. There would be just one commitment, that the applicant must be willing to make effective change.
So if a young mother is homeless with just cause and she is intentional about changing the trajectory of her life and wants life change, we can house her here in adequate time of either 3 months, 6 months, or 9 months, but it has to be less than a year so that she can adequately participate in programs, get the mental health assistance that she needs, and also the life skills training that she needs to make her more employable.
Carrie will be launching a campaign through the Together Be Alive platform by the end of July and is hoping that with the help of the community, the project can be complete in under 2 years.
TLS Services is seeking not only monetary funds, but also persons to come in and do the construction work pro bono, please, because we are a nonprofit organization and we are reaching out to the greater community, public organizations, non-governmental organizations, private organizations to assist us in our cause, because it is a critical need to assist women and young mothers at this time who are the most vulnerable.
Reporting for Our News, I'm Jillian Gray.
Well, thank you for joining us for Our News tonight. On behalf of the entire team, I'm Kyle Joaquin. Enjoy the rest of your holiday.